Hello and welcome to Birding Conversations. I'm Esther Kenigsberg, and this is our fourth episode today, where we're just going to have an open conversation about moms and perinatal and postpartum and everything a mom can feel, think, situation she's at. And we're just going to explore and talk a lot about it. And welcome to today's episode to Yocheved Silk.
Hello.
I'm so excited, Yocheved, to have you today.
I'm so happy to be here.
This is really an honor to have you here. Yocheved is one of the best medical professions that I have got to know over the past couple of years. Yocheved is a physician assistant with lots of knowledge, is a mom, definitely an entrepreneur, a grandma, and has a lot of life experience. So it is a very exciting episode, and it's an honor for me to have you here today. So welcome, Yocheved.
Thank you, Esther. And it's really an honor for me to be here. And I'm looking forward to our conversation. And
yes,
I hope that it will be something productive for everybody.
For sure it will, without a doubt. So in your practice, and as a mom, which is already for 30 years, what is it that you see in moms coming into the practice and they're either pregnant or they're after birth? What is kind of your first response in your head when you see them? She just comes with a newborn. It's 2 weeks old.
Right. So there's a lot of clues. There's a lot of clues that you might not pick up that I pick up because, A, I'm trained as a medical professional. I'm a trained mom. And there's certain nuances that you know are either normal or not normal. And I don't make a formal assessment. That would take too much time. And also you want to gain the trust of the mom. That's number one. So when you ask me, the first thing is you want to be the person's ally, whoever the person is. You want them to feel like you're going to bat for them. That's the first thing. So that's part of when I say my experience. If I was 16 years ago when I first started, I don't know that I would have had the confidence to do that. But now I know really the mom needs me on her side. No matter what is going on, she needs to feel that we have a relationship, that we're both talking about the same thing, that we're in it together. Like any other relationship, it's a relationship. So that's the first thing. So some moms are very wary. They think that, I'm there, or any clinician is there to judge them. And, it's kind of bedside manner, right? That's what we call it, but it's not. What we're really doing is fostering a sense of security and trust, and we're here for the benefit of the baby or child or adult. If they're a caregiver for an older person, it's the same dynamic in a different way.
Right.
So really, I see everything in just the blink of an eye. I see how clean the child is looking, how the child is looking hungry, the child is well fed, their mucosa are wet. All these things I've been trained to look at.
What's the eye contact between mom and baby?
Mom and baby, but I'll give you a very good example because this just happened to me. A mom came in and it was a newborn baby. The baby wasn't gaining weight, so the baby had to be weighed. And the mom, this is a newborn, remember, there's air conditioning in the office. She stripped the baby and just kind of threw her on the scale. I don't need to be a clinician to know.
To see that something
and to see.
Is.
That's a very, very extreme example, I would say.
Yeah.
But those things happen on a much smaller scale all the time. And if you can see the periphery at the same time as you're looking at the mom and saying, I want to help you. How can I? You're not saying that, but that's the vibe that you have to express. I'm here with you. I'm trying to
I'm not here to judge you.
With you. It's sometimes hard to do because sometimes a child smells. Sometimes a child has sores all over. Sometimes the mother is speaking not nicely to the child. And this is not a well mom. The mom is not feeling well. The mom has maybe
Can get tricky.
It's very tricky. But you still have to remember that who's the patient? The upper mind, who's the patient? The patient is really, if it's the child, it's the child. And the mom, in order to be able to help the child, you need her cooperation. You need her to trust you.
And there are many times the mom simply needs help herself.
For sure. So
if it's physical help, if it's emotional help,
sure.
if it's the right
financial
advice, financial support, you name it.
Correct.
Like the whole 9 yards.
And they also just need some resources. Sometimes people are so overwhelmed by their daily life. The whole list that you just gave me, it could feel like there's no support. So they just need resources. And if you're on their side and they feel they're on your side, that you're on their side as a clinician, you're just a mom. You're just there to chat and to help them. All the resources that you give them, they're going to trust you. And hopefully you are able to follow up with the mom. It's not a one-time. It's not the person comes in with the child and it's a one-time thing. It's not a one-time thing. We understand that if we develop a relationship.
It's all about that. But I have to say that I remember myself, and maybe you too, I am older than you, a few years, but you maybe remember the same. I remember when I was a child going to the doctors back in those days, the doctor had the time and the interest and spent the time. There were less machines around at that time, less sending for x-rays, less sending for MRIs. Was more the doctor looking at you, understanding what goes on at home, what goes on with you, what goes on with work. And I think that everything makes a difference because we're not 10 people. So how this mom here, if we're going to go back to the mom and time of pregnancy, time after birth, she's not 10 people. She's one person. And her mind, her spirit, her body, her emotions, her everything is being tied together to one person. And I find today's days the doctors have less time.
Yeah.
And less patients maybe. And also it works by insurance and the time zone, how many minutes you delegate to each mom. And I have to say, Yocheved, that with you, I have seen it on a personal level. You are giving the time and the dedication, and you really, you care.
Yeah.
And that care comes across.
But I always say that if I don't do this for I don't do this for remuneration. I'm not looking at how much money I'm making. It's never, I need to do more hours because I need to pay my rent or whatever. Because if I ever felt like that, I told you this before,
yes,
I'm going to quit. It's about, I need to have that rapport with my patients. I need to feel like I'm a part of their life, not because I need to know the details of their life, because I'm making a difference. It goes back to, it takes a village to raise a child. I'm part of the village, whether it's adult medicine, child medicine, I do all of it, right?
Right.
So I see the moms on the other side. I do women's health. It's a big part of my practice in Brooklyn. So I see the other side. I see the mom without the child. I see the children too. And if I'm not part of the village, I have no business being in this business, right?
Yeah.
And that's
Which is true. I always say, if it's not for you, choose a different profession for whatever the profession is.
Yeah, you can go to the emergency room and work in the emergency room where you see patient, you diagnose them, send them home. It is, it isn't, by no follow-up, right? What's so crucial and different about what I do and the way I approach it and the way I feel what you're saying is that it used to be that medical professionals spent a lot of time. They developed that rapport relationship. That's the way I want to I have the luxury to do it because of the way I choose to fill my time and where I choose to practice. I really don't want to take a lot of jobs that are offered to me for this reason, because I want to be able to have that rapport and relationship. And I have to say that during COVID, for example, when we had a peak of anxiety, depression, and we're still dealing with that, we're still having the fallout from that. I have to say that I pulled back a little from my practice. I did wind down afterwards. I got burnt out from it. So you have to know, as a clinician, as a person who wants to help other people, where that, you say the mom
Boundaries.
walks into the room, it's gone back to that. Boundaries. Can I take this on? Do I have the capacity? Can I grow to hold this person, this family, this child? Do I have room? And if I don't have room, I have to be big enough to say, I can't do this, because that's really the bottom line. And not all people
rather than taking it on and not being able to be there.
Exactly. And there aren't so many. I don't see it. Like I keep saying, I don't have a doctor. I don't have a doctor.
I know.
Because my doctor passed away, and he was an old-time European doctor. So we're going back to this. How was mental health approached? How was any postpartum, any time of having a baby, prenatal, postnatal, raising children, family dynamics? Maybe there were social issues. Maybe there were financial issues. The doctor was really involved in all of that.
Absolutely, which we don't see anymore.
No.
And now we're talking about COVID, and you're saying seeing depression and anxiety during COVID, I think it increased a lot. COVID did bring a whole new level of an anxiety to the world. If it's psychological from the trauma of COVID, if it's maybe from the post-inflammation of COVID, maybe a combination. There are a lot of aspects that we can touch on it. But what I want to ask you, what did you see in your practice during COVID, and maybe moms that are still dealing with it till today, they're not having their husbands at birth time, being tested and maybe separated from the baby because one of them tested positive. So many situations. What is it that you can share that would be some, like some good medicine for moms that are listening to this and that they can take along? And how do you see the situation now?
So I think a big part of it was a feeling of isolation. And when someone's going through pregnancy and having a child, and whether the family's growing, it's their first child, their second child, they need their family support. They need their involvement of their neighbors, a food train, visitors in the hospital. A big deal is made over the baby. People come to visit. It's a whole.
For the ones that need that. Yeah.
But people do need that. Because we are all social animals. Some need it more than others, but it was a big part of having a baby, expanding your family. A party when the baby was born, a family celebration, however it is you do it in your culture. But there was a mark. We marked this event. We lost that. We were isolated. Women were home alone with their children or child constantly. They weren't going out. And there was no change of routine. And that put a lot of stress on people. Plus, financially, they didn't know if they were going to have money because jobs were going away. People didn't work.
Right.
That was the reality. So, yes, that just feeds. When people are in isolation, they will feel more depressed if they're already depressed, or it can bring on depression or psychosis. I did see with the COVID itself, there was encephalitis. So there were definitely people who were affected by the disease itself or the implications of the shutdown. And I remember getting a call, and I was in Washington, D.C. during isolation during this COVID time. And I remember getting a call from a father who was a friend of my son, and he had 4 children. They were living in a tiny little apartment in Brooklyn, closed up with it. I said, "Do you have a car?" "Yes." "Do the children all have bicycles?" "Yes." I said, "Put the bicycles in the car and drive to Prospect Park and ride around the park." He said, "But it's COVID." I said, "And is there a rule against going to the park?" "No." "And if you feel better wearing your masks, then be my guest, but outside air, it would be fine." He told me this saved their life. Yeah. Another person called me. She was a cousin of mine, also 7 kids in a tiny little apartment in Brooklyn. I said, "Do you have a car?" "Yes." My husband comes home from work 6, 7 o'clock. I put the kids in the car, drive to the boardwalk.
Just go out.
Saved her life, her sanity. They had to change their routine. And so women who just gave birth were in a different situation. They had to stay home. It was cold. It was still March and April.
Right.
They were really isolated. And this had twofold. People around them couldn't notice if there were any changes in their behavior, their family, or their doctor, because they didn't go. Everything was on Zoom. So the doctor couldn't assess. Like you said, a mom comes into your office. Well, if the woman's not coming into the office with the baby, you can't really assess everything so well.
What can you see? It's
you can see something, but it's not the same.
Not the same.
So we lost so much of what we relied on as people, just human beings.
I remember one of the teleconferences during the midst of COVID that I gave, and I named that teleconference, and I said, questions most asked. And it brings me back to our conversation. So one of them was the isolation.
Yeah.
No one sees me. I feel so alone.
Yes.
I'm scared.
Yes.
Those were, motherhood, parenting, of course, marital issues. They were so stuck with their husbands at home. So
right.
For some it worked, and for some it brought out the worst and realized certain things, which some cases I know it worked for the best,
right.
because it got them to
but
realize.
You can't divorce your baby, right?
If
you have a 4-week-old baby that doesn't stop crying, and you can't go to the doctor because the doctor's office is closed, and your mom can't come to watch the baby for a few hours to give you respite, you can't find a nurse to come, a cleaning lady.
You can have all the money, but if you can't get a worker in.
Or get some respite. That's what I think a lot of the moms were just desperate for help, desperate for a change of scenery, but you remember being a new mom. You just wanted another pair of hands to hold the baby so that you could take a nap. That wasn't happening.
Right.
It wasn't a luxury. It's a necessity. It's part of how we were having children before, and how we're having them now, and how we raise our children. We rely on our community.
And Yocheved, between your children, you have the older children, the married ones, and you still have young children at home. So do you see a difference in the timing of having a child back then to having them?
Yeah, for sure. So back in the day, I think there's a lot of things. From a medical perspective, now when a woman has a baby, 24 hours later, she's sent home with no bottle, first of all. You have to breastfeed.
Which,
no bottles.
That's a conversation for
itself. That's a separate conversation. But 30 years ago, when I had my first baby, you stayed in the hospital 3 days, at least.
At least,
even if you didn't have a cesarean. They made sure you were able to breastfeed the baby. They gave you bottles to supplement if you liked, a whole thing of formula. And you were sent home with, I went with my first baby to my mother. That's how we did it in our community. But, went to the pediatrician the first 2 weeks, made sure the baby was feeding well, gaining weight, all the normal things. And you gauged everything based on if you were a person that was reading, then what you read, or if you were with your family, what your family told you. Today, everything, and I find this in my practice, and I find it with myself, everything's social media, right? So you compare. Yeah. You're comparing yourself with maybe the Kardashians who gave birth and 5 minutes later were as svelte as ever and as beautiful as ever. And that's your gauge, not your family, not your community, not point.
Yeah. The comparison is really a self-killer.
But we're doing it to ourselves. It's a conversation that everybody has with themselves. I'm not as good as her, right? So who are we comparing ourselves to? It used to be, it was our family. It was the way my sister-in-law did things, or the way my sister did things. And now we're looking at people who are not real. And we're comparing ourselves to them. And we're listening to the voice and saying, you want to be like that. And the other thing that I also see different is I had my first baby 30 years ago, and then I had 3 children. And then my next child, my 4th child, was born 15 years ago. And when he was born, my husband said to me, well, we have to hire a nurse. I said, a nurse? I never heard of such a thing. I will go to my family or whatever, and my family will help me. I'll hire somebody to clean, but a nurse to take the baby at night? I never heard of such a thing. In certain cultures, and it has become very prevalent, you hire a night nurse. It's unheard of not to.
It's a life savior.
It is a lifesaver. I think
that.
It's wonderful. I think it's wonderful, but it's a change. You asked me about change. So it used to be you moved into your mom's house for 2 weeks or whatever it was, and she took care of you and she fed you, and you just slept and nursed the baby, right? And your mom changed the baby, took care of the baby. Today, our lives are so busy. Our moms cannot host us for 2 weeks. They're working. They have their life. So now we hire a nurse, which is great, but somebody has to do it. I understand. Yeah. But our life has changed. That's the big difference.
When I look back at my 3 kids, like you say, my oldest, I've been by my mom probably 5 months. My second one, I took shifts with my husband. A half a night I did, a half a night he did. And by my third, I had a night nurse.
So do you think...
for a long time,
but who's picking up on the cues if something's wrong? The night nurse? Your mom?
But you know what? I had enough of a support system besides. Okay, me, myself, personally, I was back to work after 2 weeks. And I was happy, but I did not work a full day. So thank God, I did not experience postpartum depression.
But if you would,
with my baby.
Right, but if you did,
my mom would pick up, my husband would
but
have
a night nurse might not have picked up on
Maybe
it.
not.
That's my point. And also, do you remember The Good Earth? Did you read The Good Earth?
No.
Oh, it's a classic. Anyway, it's about this woman in pre-Mao China, and Pearl S. Buck wrote the book. It's a very old book. It's a classic. And she's working in the rice paddies, and it's her time. She lays down, she gives birth, she puts the baby and swaddles the baby on her back, goes back to work. We can't do that. And it's not normal, but that was the norm. So our norms, you asked me what's changed, our norms have changed, right? We do not move in with our families anymore. Our families were very attuned to something's changed, something's off, the baby's not bonding, or the mom is crying a lot, or there's a loss of interest in activities, or there's just a dissonance in how the communication is going with the spouse or the parent or the child.
Someone looking over. In the good case scenario.
So that was the way it was.
I just have to say, too, that with a night nurse, why am I a big believer in it? Because I don't believe in being super mom.
No.
A mom cannot do everything. No. And we're going to talk about balance in a minute.
Right.
But myself, let's say, as being a working mom and being the best mom I could be and bond with my child and still being a wife and a daughter, like you said, and having a family business and so many different directions, the fact that I was able to know that I have a reliable nurse, I knew whom I hired, and I had a colicky baby that's crying, and I can still get a few uninterrupted hours of sleep at night, made me a better mom. Sure. So in a way, the help that's available today's days is a benefit, because think about being at your mom. So me being at my mother back then, so I'm one of 3 children and I was the youngest. My parents had a big house and we were the only couple there with their new grandson. But if you're talking about going back to a parent's house, that the mom herself still has little children at home, and it's chaos and it's noise, it's the support of the family and the husband is crucial in the mom's well-being. I totally agree with that. But at the same token, how much can she really rest? So we have everything has...
No, listen, Esther, I started a business for this so that women would have baby night nurses and help in the house for the beyond our cultural narrow confines. So for the world out there, I started this business. I know what's needed out there. I believe in the concept, but the concept is there because we no longer have these cultural norms where Oh, you have a baby, you rest for a month. You're not going
At
out for
least.
6 weeks, right?
Right.
We'll feed you bone broth for 6 weeks, and we'll feed you all these foods, like in the Chinese culture, ginger, and they have a whole diet that you have to eat for 60 days, I think. Maybe it's 40 days, 40 days. You can't even go out. So, but that doesn't exist anymore. There's some places in Beijing, they have these hotels for moms to move into. In New York, we have that for some of the Jewish women. But our culture has changed, right? Our norms have changed.
And the times changed.
And the times changed because mom is working. She can't do this anymore. So, yes, so that's what's changed. And I've seen it in my own life.
You have seen it. And how would you say yourself, as a professional, as a mother, where would mom find a balance? Does balance exist?
Well, the first thing I think is to give yourself permission to have balance. I think that's very important. So that means that, yes, I have to work because I have to help pay the bills, bills have to be paid, or from self-fulfillment, whatever the reason is that you work. But it is okay to take a break and do the things you love. And if you don't have things you love to do, then develop those things. You have to have permission. It's okay. And that's...
To give yourself permission.
Yeah. You have to give yourself permission to take a day off and just do the things you love. Or even if you don't have that luxury, whether it's a song that you love to listen to, a 5-minute bath before you have to run out and do something exertional.
Some Epsom salt.
Yeah, but some people don't like that. But so whether it's auditory, right? I always think about this. I use this example with my patients all the time. I say the things that we do, the negative things, the foods we eat, the negative behavior, it's because the emotions that it provides to us brings back memories, good emotional memories. For example, we would spend a lot of time with my grandmother every Saturday, and then Saturday night she'd say, okay, she's making French toast with maple syrup from Vermont. This is my best memory. Now, when I feel ick and I don't feel good and I've had a bad day, what do I want to eat?
French toast.
French toast with maple syrup from Vermont. Why? Because I could feel my grandmother. I could see my grandmother. I could smell her. I could smell the kitchen. Is it the same that she made? No, it could never be. But it's not that. It's that feeling that I'm trying to recreate. So when you want to eat,
associated with,
you associate the memories, right? So when you eat fried catfish, and I have patients who eat fried catfish, it's a Southern food. It's very unhealthy, but it's because that's what grandma made for you.
Yeah.
So it's the same thing with self-care or whatever you want to call it, balance. We need to balance by saying, I will indulge. And we don't even use the word indulge. It's not indulge. It's valuing myself and taking care of myself. Whether, like we said, it's a 5-minute bath, or I'm listening to a music that I like to listen to for 5 minutes, and the door is closed and nobody's interrupting us.
Listening to birthing conversations.
Listening to birthing conversations. Calling a friend, chatting, going for a walk. If you love to run and those endorphins are what kick in for you, and that's what makes you feel good, then do it.
Right.
Get up at 5 and do it, because that is what's going to make a balance for you.
I always say tea time is me time. And whatever tea time means to you, and to me, can mean something else than to someone else.
Right.
But give yourself that tea time.
Right. Right.
Because without that, and what would be the ideal time if we can just choose that you think a mom should go back to work?
It depends on the mom, and it depends on the reason that she's working. There are so many realities in our current lifestyle. But some people, their self-care is their work.
That is true.
So then there is no time frame.
So when I told you that I went back after 2 weeks, definitely for self-care, that I can personally not sit home the whole day, wouldn't make me a better mom.
Right.
A better mom would be if I go out a little, and then I come home all excited to my baby, to my family, and would make me a better mom. So you're right with that. I agree. You need to be aware of about who you are as a person.
And it's again cultural, because in Europe, especially France, a mom has a year paid leave after she has a baby, right? That's social, that's their social medicine kind of way they've adjusted to their socialist norms, right? It makes sense. But I don't think we have that in America. We have 6 weeks at most.
Which is at most.
But it's just, some women want to go back earlier. Some want to get that full year. So they're working, the legislators are working towards that. It makes sense because, as we know, the postpartum time frame can be up to 3 years after the baby's born, right?
3 years? That I hear for the first time.
Yeah.
To me, I always, in my mind, I knew easily a year till the hormones.
Some data shows up to
back.
3 years. Some data shows up to 3 years. But, that's not conventional, but definitely a year.
So, Yocheved, I'm going to give you the last word here. What would be advice from you to a mom, as a professional, as a mom, as a grandmom, for her to know she gets the right care she deserves? She's should she reach out for help? Shouldn't she? Where is she in life? For, they're not all going to see you as their clinician. Right. I wish. So what is it that you can give them to take away?
Right. So the most important thing that I would say is, whether it's the dad, the mom, the sister, the brother, it's okay to call someone else. If you feel that you're not being understood, if you have another question and they're not giving you time, the clinician is not giving you time, it's more than okay. Please call someone else. It will be the greatest gift you can give yourself, your family, your loved ones. Just make another phone call. You have nothing to lose. Nothing.
That's very good advice. Very valuable. Thank you so much, Yocheved.
My pleasure.
This was a great conversation. I certainly enjoyed it a lot.
I enjoyed it very much. Thank you.
Thank you so much for being here today with me.
My pleasure.
You.